In this video, we are going to talk about Afib medications for rate control. Which ones work, which ones to avoid, and what are the potential side effects. Whether your treatment strategy for Afib is rhythm control, which means to stay in regular or sinus rhythm, or rate control, which means to just keep the heart rate from going too fast, you may need to be on medications that slow the heart rate in addition to medications to prevent stroke. For most people, but not all, Afib makes the heart rate faster. This is because electrical signals in the top part of the heart, called the atria, are not traveling in the usual coordinated fashion. The AV node, which is the electrical gatekeeper between the atria and the bottom chambers of the heart, called the ventricles, is being bombarded by multiple electrical signals. The result can be that the heart rate is fast and irregular. Because of this, doctors use medications that slow the electrical signals through the gatekeeper or AV node to slow the heart rate. There are two types of rate control medications that are commonly used. Number one, beta blockers. Beta blockers are the most commonly used medication for rate control in Afib, with the most frequently used one being metoprolol. Atenolol and carvedilol are also sometimes used. Beta blockers are blood pressure medications, and they can cause low blood pressure and dizziness in some people. Other side effects of beta blockers include fatigue, depression, and erectile dysfunction, although these are uncommon. The second common medication are calcium channel blockers. The most common calcium channel blockers that are used for rate control in Afib are Diltiazem and Verapamil. Diltiazem is most commonly used because Verapamil tends to have more issues with constipation. It's important to note that some calcium channel blockers do not lower the heart rate, such as amlodipine and felodipine. Diltiazem and Verapamil should not be used in those with depressed ejection fraction or squeeze function of the heart. Diltiazem tends to be well tolerated. The most common side effects are swelling in the ankles and low blood pressure, as Diltiazem is also a blood pressure medication. There are other medications that can slow the heart rate, although they are rarely used because of their risk for potential side effects. One of these is Digoxin. Digoxin is rarely used for rate control in Afib because it can more easily get to toxic levels than most other medications. Another reason Digoxin is seldom used is because research studies show that some people have a higher mortality or death rate when taking Digoxin. Digoxin is used more frequently in people with low blood pressure because beta blockers and calcium channel blockers lower the blood pressure, whereas Digoxin does not. It is also used in some people with a history of heart failure, as it may help reduce the risk of hospitalization. If at toxic levels, Digoxin has numerous side effects, including heart rhythm problems that can be life-threatening, nausea, and visual problems. The second medication that can slow the heart rate but is not used very frequently for that is Amiodarone. Amiodarone is the most effective medicine for keeping people in regular or sinus rhythm, but it also can slow the heart rate. Cardiologists are reluctant to use Amiodarone just for rate control because of its potential side effects. The side effects of Amiodarone include toxicity to the thyroid, liver, lungs, eyes, and skin. Typically, patients on long-term Amiodarone have periodic screening for thyroid, lung, liver, and eye issues. Many people with Afib need medications to slow their heart rate down. The most common choices are metoprolol and Diltiazem, but other choices may be better depending on the patient. Talk to your doctor to determine if you need rate-slowing medication for your Afib, and if so, which is the best choice for you. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching, and if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.